Welcome. I'm Leslie Canham.
I'm Mary Gavoni.
I'm Linda Harvey.
I'm Olivia Wan, and together we are the Compliance Divas.
Welcome to the Compliance Divas podcast. I'm Leslie Canham, and I'm the moderator of this podcast, which will talk a little bit about how we might be able to provide patients treatment in our dental offices who have special needs, particularly focusing on autism spectrum disorder. We bring clarity and simplicity to compliance by navigating regulatory compliance to keep you on course. We invite you to subscribe to the Compliance Divas podcast through your favorite podcast channel or on our website, thecompliancedivas.com. The resources that we mentioned during our podcast can be found on our website, thecompliancedivas.com, and we welcome any questions that you have if you will send them to support@thecompliancedivas.com. Well, I'd like to start out with explaining a little bit about the statistics of individuals who are what's called on the spectrum or autism spectrum disorder. According to Centers for Disease Control, 1 in 36 children is diagnosed with autism. 2.2% of adults and 6.7% of diagnosed have profound autism. Boys are 4 times more likely to be diagnosed with autism than girls. However, it's likely that this number may be a little off because sometimes the diagnosis for girls is underreported. California has a higher average rate of autism spectrum disorder diagnosis, about 1 in 26 children. And according to the World Health Organization, worldwide, 1 in every 100 children has autism. So you can see that there's quite a number of individuals who are on the spectrum. Every community has patients with autism, and everyone needs a dentist. And the point I think of this particular podcast is to bring to the surface that patients with autism often struggle to find dental care. Autism is unique and complex presentation is different from person to person. So we may find that ASD, which is autism spectrum disorder, and autism are both general terminology used for a group of complex disorders of brain development. So what I'd like to do is help us discover how our dental office may be able to provide dental treatment to patients who have autism by making some simple changes. What I'd like to start out with first is just bring this question over to our diva, Olivia. Can you explain to us what autism is?
The DSM-5-TR, which is the 5th edition text revision of Diagnostic and Statistical Manual of Mental Disorders, is what is used to diagnose neurodevelopmental and mental health conditions. And it merges all autism to autism spectrum disorder, including autistic disorder, Asperger's disorder, pervasive development disorder. So in answer to your question, Leslie, autism spectrum disorder, which is known as ASD, is actually a developmental disability caused by differences in the brain. Scientists don't really know yet exactly what causes these differences for most people that have ASD. However, some people with ASD have a known difference, such as a genetic condition. There are multiple causes of ASD, although most of them are really not yet known. There's usually nothing about how people with ASD look that sets them apart from other people, but they may communicate, interact, behave, and learn in ways that are different than most other people. So the learning, thinking, problem-solving abilities of people with ASD can range from gifted to severely challenged. And some people with ASD need a lot of help in their daily lives, while others need less. So a diagnosis of ASD now includes several conditions that used to be diagnosed separately: autistic disorder, pervasive development disorder, not otherwise specified, and Asperger's syndrome. And these conditions are now called autism spectrum disorder. There's no medical or genetic test for autism, so the diagnosis is based on clinical diagnostic testing by trained physicians and psychologists. And it's based on the autism specific behavioral evaluations they administer, and also the information, observations collected from parents, caregivers, and teachers. So, Leslie, with that said, do you mind telling us about the characteristics and behaviors of individuals with autism?
Well, Olivia, there are common characteristics and behaviors of individuals with autism, but every individual is unique in the presentation of these characteristics and behaviors. Individuals with autism may or may not present with all or some of the following characteristics or behaviors. They may have social communication challenges. They may struggle with initiating and maintaining conversations and can also have difficulty understanding the perspectives and the emotions of other people. They may have difficulty understanding and using verbal and nonverbal communication cues, such as gestures or facial expressions, tone of voice. According to the National Autism Association, 40% of individuals with ASD are nonverbal, while other studies show that 25 to 30% of children with ASD are minimally verbal. And we don't know why some people with ASD are nonverbal, but it's important to note that their lack of verbal communication is not due to a lack of intelligence. Some people with ASD exhibit behaviors such as hand flapping, rocking, spinning objects, or they may have uh, adherence to strict routines and rituals and resistance to change in a schedule or an environment. They may have difficulty understanding and responding to changes in routine or expectations. And they also might exhibit intense focus on specific topics, objects, or activities to the exclusion of almost everything else. So they're really focused on that one particular thing. Some may experience what's called sensory sensitivities, such as heightened or diminished sensitivity to sensory stimuli, including light, sound, texture, smell, and taste. And sometimes they may be even overwhelmed by sensory input, causing sensory overload, which may or may not lead to meltdowns that could occur in overstimulating environments. They also sometimes might have a meltdown due to difficulty with flexibility and adaptation. Uh, with that being said, what I'd like to bring this is back to a focus on dentistry. So I'm going to ask our diva Linda to tell us a little bit about the oral manifestations that we might see.
Thank you, Leslie. I think this is such an important special needs patient for us to speak about, and particularly their dental needs, because many of our listeners may have patients with ASD. So the oral manifestations can include bruxism, non-nutritive chewing, and tongue thrusting. So from the provider side, we may find in a general practice that they have caries, and that would be similar to the general population, and they may have some erosion due to regurgitation. And sometimes patients with ASD may exhibit these habits: picking at the gingiva, biting the lips, creating ulcerations, and even the home care measures may be difficult for many patients with ASD. So individuals may also have very limited diet. So some of the individuals with ASD may, for example, be eating exclusively pureed fruits and vegetables. And maybe sometimes the texture, smells, and flavors can impact what an individual is able to consume. We know that sugar intake may be high, as many individuals with autism crave the powerful sensory input from the sweet sugar food. And sometimes don't we all, but especially with this group of patients. So as we know, the home care measures may be difficult, Leslie, for many patients with ASD. And it could range from difficulty in holding a typical toothbrush to resistance to toothpaste or other behavioral issues. So it's incumbent upon our dental team to be creative when working with these patients to help work with their family, their caregivers, to find strategies and techniques to help them to maintain optimal oral health. Back to you, Leslie.
Thank you for that, Linda. And I wanted to mention our diva, Mary Gavoni, could not be with us today, but she wanted to make sure that our audience knows of the resources that can help dental professionals make small changes to be able to accommodate patients who are on the spectrum. And we have references for Centers for Disease Control, which we will include in our show notes. We also have a really amazing kit called Autism Speaks, the Dental Toolkit, where we will provide that information to our listeners. And then there's another association called SARC, which stands for Southwest Autism Research and Resource Center. And it has a toolkit called Dental Care for Individuals with Autism. So we have lots of different resources that will help our listeners accommodate individuals in their community who need dental care. And to give you an idea of what we might find as advice for dental experts or dental professionals in the way that they might make these little changes is to first advise us or advise all of our dental professionals to develop a relationship with the patient who has autism. And we'll talk a little bit about how to do that in a minute. Speak in a calm and soothing voice. And of course, in dentistry, that's something we try to do all the time. If you have a child, you want to get down to the child's level and be confident and reassuring. When we talk about how we might approach someone who's on the spectrum, we may not want to ask them if they want to come back with us to the treatment room, but rather gently tell them what we are going to do next. They also have a recommendation to be consistent. So, with those tips in mind, there's something else that we can do in dentistry. We can get our dental practices ready for receiving a patient. So, since every person with autism is different, some of these suggestions may work for one patient with autism, but not for another. If you have a child, you may want to ask the parent first if there are suggestions that may help you better meet the needs of your patient with ASD, and allow the patient perhaps to bring in a comfort item with them to ease anxiety. With the toolkits that Mary mentioned, there are some checklists and forms that you can send out to the family or caregiver or parent to give you an idea of what you can do to help prepare your practice with the very special needs of that particular individual, what things trigger maybe a poor response, and what things are also help to praise the individual. Since again, each child is different, some of these suggestions may work and some may not. But again, gathering some facts from the parent or caregiver would be very helpful prior to the appointment. Sometimes it's a matter of dimming the lights in a treatment room or turning down loud noises. If you think about what a model trimmer sounds like, I know that could be very loud, or a compressor going on. You may want to be very strategic as to what treatment room you would bring that person into. You may want to also, before you perform a procedure, for example, using an air and water syringe, show the patient what an air and water syringe does, or show them what a prophy cup does, or a handpiece with a burr in it. Remove the clutter in your practice so that you don't have things that are distracting. And again, let the person know what you're going to do, where they talked about showing the person what you're going to do. And then, for example, you're going to tell them you're going to count their teeth, and then you're going to show on maybe a home care instruction model the teeth counting process, and then you can pick up a mirror and explore and then count their teeth in their mouth. It makes it a lot easier. And then we want to make sure that every visit we end it on a positive note so that the dental professional and the patient can build upon success. With that being said, it's helpful to have the same team members for each visit. It's also helpful in having the same room for each visit. Families can certainly help you prepare for that visit ahead of time, because they may want to practice having a dental visit in their own chair. For example, they can have their person, whether it's child or whether it's an adult, or sitting in a reclining chair, and then teaching them the steps that they might experience when they come to a dental office. And we might start with simple steps. They suggest giving instructions, sort of like Simon Says. Put your hands on your stomach, then put your feet out straight, and then opening wide, and then holding their mouth open, and then counting teeth. And then you might clean with a toothbrush, showing how a dentist or a dental professional hygienist might use something to clean their teeth. You might do something like biting on a popsicle stick for maybe the process of biting down for x-rays. And if the person has never been experienced at having a saliva ejector or an evacuator, maybe suggest to the dental practice that they try having that patient spit into a cup if it would be overwhelming to use something else. As opposed to just jumping in and thinking, well, so saliva ejector isn't scary for patients, but it could be very scary along with the noises that it produces. So again, there's lots of things that we can do to help with areas of behavioral issues or challenges for the patient or sensory issues, and just reminding us that we can make small changes in a dental practice that make big changes to patients with special needs and their families. Circling back to the same phrase, every community has patients with autism and everyone needs a dentist. So with wrapping up, we want to make sure that our audience members take a look at the resources that we will provide on our show notes. The Compliance Divas will help you with any questions that you have. If you will send your questions to support@compliancedivas.com. And again, we like to help provide clarity and simplicity to compliance by navigating the regulatory compliance environment to keep you on course. With that, we close this special edition of the Compliance Divas podcast on accommodating patients who have autism.